As you leave today, you can look at all the historic words that come from the Wilder Will on our ribbon of values, historic values. One of those historic values of the Wilder Foundation is create access. It's been one of my sort of, I harp on this all the time. I think there's been so much focus on quality. It's one of the key focuses of the statewide Raise to the Top Early Learning Challenge grant. And we don't hear enough about access to that quality. So I thought, let's have a forum. And I think you must agree because here you are as well. What I'm afraid of is if we, without more access, if we focus on improving quality without that, we could actually widen the gaps between the haves and the have-nots. We could exacerbate the readiness gap and the achievement gap. We could make the disparities in health and in development wider without making sure that everyone has access. So to me, access is really, it's a financing issue of equity and inclusion. That's what access means to me. And let me show you why that is. So we have 427,000 kids 5 and younger in Minnesota. This group of young kids is the most diverse part of the state population. Compared, 31% of kids 5 and younger are kids of color. 4 years ago, about 1 in 4 kids were kids of color. Now it's 1 in 3. It's a fast-growing part of our population. It's the most diverse part of the population. And unfortunately, it's also the poorest part of our population. This looks at the poverty rate for kids, and you can see the highest rate of poverty, 17%, is for kids. This is 4 and younger. And you can see the line that's over the past several years is the steepest. So this distressing steepness, what it means for those of you who are associated with or run programs that have eligibility requirements of income, that you can't keep up with the demand. Food shelves can't keep up with the demand. Head Start can't keep up with the demand. There's too many growing eligible people to be, and not enough growing access. The group we're looking at today is actually nearly double that. We're looking at kids, I'm calling their low-income kids. These are the high-need kids that were part of the Race to the Top application. So if there's 17% in poverty, there's another 20% that are between 100% and 200% of poverty. So what we're talking about today is access for low-income kids. Roughly $44,000 for a family of 4 is what we're talking about. It's 37% of kids age 5 and younger are in this low-income group. It's 156,000 kids out of those 427,000. They're the low-income kids we want to increase access for. What's more distressing is how disproportionate this is in these communities of color. So if you look at the American Indian population, if you look at the African American population, there it's more like 3 out of 4 kids are in low-income families. And I could be accused of masking the problem because half of these kids or more are actually in poverty at the low end in those populations. So there's a real disparity between the white kids and the other kids in this state. It's so disparate, and because of the growing number of these kids, that half of the low-income kids are kids of color. Half of the low-income kids in this state are kids of color. That's why, to me, this access issue is at its heart an issue of inclusion and equity. These are the kids that are our future, and they are being left behind. So to give you a number of how they're split up, so there's 156,000 of them. They're roughly evenly split. There's a little more 3 or 4 or 5-year-olds, 80,000. There's 76,000. That's our base of how many of these kids have access to some sort of early learning opportunity. That's what we're trying to do here. Before I do that, I want to give just a little recap of some of the other issues around that are pertinent from this child care study we did for the Department of Human Services back a few years ago. So we know that most of these young kids are in some form of regular child care. So just 31% of kids 0 to 2 are there at home with a parent. 18% of 3 and 5-year-olds are at home with a parent. This study included family, friend, and neighbor care as a type of child care. So it includes regulated, licensed early care and education as well as family, friend, and neighbor care. you can see most kids are in some form of child care. Part of this issue of access has to do with what families can afford. It's a big part of the access issue. So if 10% of income is considered affordable, you can see for the low-income kids or families, the bars on the left, that they're paying double or triple of their incomes than is affordable if they're paying for childcare. So what they can afford limits what they can use. In addition to that affordability, this patterns of use are also related to the opportunities parents have for resources and the choices they make. And family, friend, and neighbor care is the choice most parents make, or at least half of parents make, for the younger kids, the kids ages 2 and younger. So for many of them, it's their first choice. They want someone they trust, someone that, especially in communities in cultural communities, someone that they can learn their own home language, transmit culture, and so on. It's there when parents need it. And it's usually affordable because for the most part it's free. So it's mostly grandparents. But then you see by age 3, grandparents say, I'm tired of this, send this kid to childcare, and they end up, half of them then in centers by age 3. And then both types of home care, whether it's formal or informal, the licensed family child care or the family, friend, and neighbor care, they drop in use starting at age 3. But this is associated with the kinds of resources that parents have. So in this state, we have the Child Care Assistance Program, known as CCAP. That's what I call it. A lot of people call it CCAP. Now, it's used by about 14% of low-income families. There's a waiting list of about 7,500 families. It comes with all sorts of restrictions and eligibility issues. The worst or the best or whatever the most stringent anyway, is a requirement to work or to be in some sort of approved activity. The focus is not on the child's development, or even if this program is quality, it's on the employment status or the welfare status of the parent. Even so, if parents get access to subsidies, you can see if they have CCAP, they're more likely to be in a center-based than if they don't have CCAP. And if they don't have CCAP, they're going to be more likely to be in family, friend, and neighbor care. So there is a relationship between having resources and the type of care you use, or if you decide you want to use center-based care, if you can go out and not to be on the waiting list, and you can afford, if there's a copay, you can afford it, then you would go in and seek out center-based care. Okay, so now I'm going to try to count up the access. You really can't do it because we don't have an integrated data system across the state agencies to unduplicate. So I did the unduplication as best I could. I took the Race to the Top application. I took agency reports from Health, Human Services, and Education. Some of our reports. I took the Metro Alliance for Healthy Families report. I did all sorts of, unduplicating. And the other caveat is, so you can't really unduplicate, but it's a pretty educated guess, or I'll say it's educated guess. And then, educated estimate. I now head up our economics studies. It's a faith-based educated estimate. This much I know is true. And so it's that, and there's no guarantee it's tied to quality. Okay, there's no assurance that this will actually lead to the goal of healthy child development, but it's a place to start. So, start up with our programs, they're public school programs. Early Head Start, School Readiness. So early Head Start, they roughly serve 10% of the eligible population for Early Head Start. It's probably closer to 7 or 8% now because of that growth in poverty. Head Start serves roughly a third of the eligible. Together, that's about 14,000 kids. School Readiness serves roughly 23,000 kids. That might be the only preschool program available for many parts of the state. It's for 3 and 4. It's for 3-year-olds up to kindergarten. There's some eligibility requirements of income. Sometimes it's used for kids who are learning English, kids with special needs. But it's one of the biggest programs available for throughout the state. Add in some special education. So this looks at, so we know that for the older kids, 3 to 5-year-olds, about half of them are receiving special ed already in a child care setting or a program on a regular basis. The rest are not. So ones who aren't on a regular basis in a program, they're included in this count. The race to the top is using some Title I money, which is to help low-income kids that are disadvantaged with regard to educational achievement. It's often not used in preschool. This is going to target 2,500 slots a year for pre-K using Title I money. So it's another 2,500. The Child Care Assistance Program, this looks at the ages of the kids in the program, and then it deducts, that's the right word, it eliminates, reduces it by 20% of the CCAP money, the subsidy money, that is used to pay for family, friend, and neighbor care, because we're looking at more regulated formal care in this access question, not informal care, parent care, but mostly the programmatic care. Scholarships, lots of attention. The godfather of scholarships is in the back of the room. Still a very few number of kids are able to take advantage of scholarships. The Race to the Top application will give us, I think it's like 1,300 a year. There's also, I think the state still has 400 or 500 scholarships that'll be the state is funding as part of their legislation. But it'll serve about 1,800 children a year. Okay, then the last piece is home visiting that comes with the curriculum, often at least for a year if they can keep the kids longer. This Department of Health estimates, or they say that 86% of the home visits are for kids 2 and younger. I know from the Metro Alliance study that half of the older kids are also in childcare, so those are deducted from this amount. And so remember, we're trying to get up to 156,000. Add it all up, where do we get to? About half. Is the glass full or is the glass half empty? Half full, half empty. Well, perhaps this slide will let you know, because if we sort this by age group, we see that the youngest age group, the 0 to 2-year-olds, get about half as much as the older age group. So access for preschoolers, we're doing pretty well. But if it wasn't for home visiting and a little bit of child care assistance, we'd have very little for the most vulnerable babies in the state, the low-income children. If you look at it another way, the access gap, it's a gaping, I call it a gaping access gap for those kids age 2 and younger. 62% is what we have to close. I guess we're doing a little bit better for the preschool kids. Okay, given, and this is, remember, this is the best. This is the best it could be, because there's still duplication in this. So even at best, we're serving only half of the low-income kids, and we're barely serving, you know, those the babies. So today, we're going to look at some options for closing that access gap. So what we know about scholarships is, you know, from MELF, from the pilot, the 4-year pilot, it started early with mentoring during pregnancy. It continued with parent involvement throughout, with early education. It had to be used in a highly rated quality program. In the end, about 350 kids actually used their privately funded scholarships in an early childhood program. For the most part, probably because they had to use that high quality program, it had good outcomes, pretty good outcomes. With regard to early literacy skills, not so much with social skills. They, for the most part, these kids were developmentally at or near age level when they started kindergarten. And then they tried to construct this, SRI International did the evaluation. The evaluation's on, I think it's still on the MELF website. And they did score better in social skills than their peers. So, and this is a model that scholarships will continue to be a part of the mix. School Readiness Connections, not to be confused with the School Readiness Program. This was a child care assistance pilot a couple years ago, $1 million pilot. It involved 9 centers. One of the center directors, Heather Reynolds, is here today to talk about it, and 5 licensed family child care providers. So this basically helped, like scholarships, it did 2 things for parents on CCAP. It got them into care, there was better care than they otherwise could have afforded, and it allowed for continuity of care. Because if they lost their jobs, the kids didn't lose their child development or their early learning experience. As Barb Yates has so famously said, when CCAP parents lose their jobs, we don't kick the grade 3 kid out of school, but we kick the age 3-year-old out of childcare. You know, it's crazy. But this actually got around the craziness. It said if they lose their jobs, the kids don't lose their childcare. And then the provider got a bump of about 25% bump to provide quality care and then to provide other sort of referral assistance to the parents. And it had pretty good results for the kids. You can see with the development and language. It didn't get approved again. The pilot wasn't continued. It didn't go to scale with the state, however. So in some parts of the states, we don't have really enough private providers to fill the need. In Itasca County, Wave Itasca County people came down. We have at least 4 people here today representing Itasca County. So they've got a community collaborative there. Essentially, they focused the 4 school districts on better services for kids from birth, improved teaching, and better outcomes for kids through this comprehensive approach. They created a common application form so you wouldn't have to go to all sorts of different places to get it. And then they blended the public school funding from all the early childhood public school funding with the private funding from the Blandin Foundation, which I call a community scholarship. You know, they helped propel this forward, and they added more money to bring more into these blended classrooms. So you don't know what funding stream is paying for those kids. It could be Head Start's paying for it. It could be School Readiness paying for it. It could be Blandin Foundation. But they're all in these sort of Head Start-like classrooms, comprehensive programming to improve the outcomes for kids 0 to 5. We've been tracking the outcomes really throughout the whole program. This looks at what the kids look like when they enter kindergarten. And we've been doing the work sampling. One of the years of the work sampling study, the school readiness study, they weren't going to do it, but I convinced them to do the 4 school districts in Itasca County, and so they've been doing it ever since. So thank you, whoever's doing it. Don't tell anybody, they're still doing it. But so we've been tracking them, and you can see after 3 or 4 years, the low-income kids with Invest Early have caught up to the higher-income kids. They are exceeding the outcomes of those low-income kids that don't have access to this comprehensive program. And we found the more the better, like you would expect, that if they attend often enough, or if they don't attend often enough 1 year, but they go a 2nd year, then it becomes often enough, and they end up with good kindergarten scores. Okay, so then that brings me to home visiting. So this is primarily through county public health departments. It blends some federal, state money. The state just received another $8 million, a federal grant for home visiting. I think it's limited to 2 models, as Sheila told me, Nurse Family Partnership and I think Healthy Families America. This also has some private foundation funding and United Way funding in the metro area. I think the state is now beginning to collect outcomes for home visiting. What I have here is from the Metro Alliance for Healthy Families, the sort of the regional alliance that serves roughly 600 kids a year. And again, if they go there often enough for a long enough time, they do come up with good child development outcomes. So each of these 4 options, which are on a pretty small scale, do produce the outcomes we're looking for. So what have you learned? Our youngest children are the most diverse and the poorest. Both this diversity and the disadvantage are on the rise. About half of our low-income kids at best have access to early learning opportunities. And there's a gaping gap for those age 2 and younger. Short of improving the economic status, the incomes of these families through better employment opportunities, tax credits, I suppose we could do that, we're showcasing 4 other options, each with these promising outcomes. And if you think about it, if you expand these kids, if they had access today, could actually have the improved income and family economic status when adults if we started with them today. So their kids could actually benefit from that if these kids had access today that most, at least half the low-income kids don't have. My rant and my dream is that our state policies would align with the values of equity and inclusion and with our goals so that all kids can have healthy child development. That's what I would like. And if we have in this state a quality rating and improvement system that is ramping up, if we could pay as much attention to access as we do to access to quality, as we do to rating quality, I would be happier. And to signify that important balance, I finally got the mechanism to show it and says not just say it. This would be called the Quality Rating Improvement and Access System, QRIAS. But while we're at it, if I'm in charge and I get to make these changes, I'm going to get rid of the Q also. And I'm going to change it to an E. And we're going to stop focusing on quality, and we're going to focus on effectiveness, and we're going to say our real goal is healthy child development for all kids, and that's what we want. But I guess that's for another time. Thank you.